My name is Nathaniel Ried, Doctor of Physical Therapy and owner of Ried Physical Therapy. So today I want to talk to you a little bit about herniated discs and talk to you about some of the things we can do to help out. So first off, the research shows that herniated discs, the material that gets pushed out of the disc can actually be reabsorbed by the body if it's taken care of properly. So this red piece that you see here is actually a material that comes from the disc and gets pushed out of the disc and then can run into the nerves that come out of the spine. Now these nerves go down to your legs and all the way down to your feet and cause give you sensation. They give you pain sensation, and then also muscle strength. So when these are getting pushed up against by a herniated disc, you're going to get pain, swelling, loss of sensation, and then loss of function, of course. So the first step is whenever somebody gets a herniated disc, the first step of the disorder is that you're going to get a lot of swelling in this area. So the swelling can then push further against the nerve that's coming out, which makes it a very painful issue. So the next thing that happens is the muscles begin to tighten up in the whole entire spine there, usually, especially the lower part. And what happens is you can have these muscles actually start to rotate the spine itself because the muscles are pulling it out of place. So as you can see here, if the muscles are tight, you can actually push the vertebrae itself into the nerve because the muscles have turned the vertebrae into that direction. And when you're actually looking at the hole that the nerve comes out of, the top part of the circle is part of the top vertebrae, and the bottom part of the circle is part of the bottom vertebrae. So what that means is once those muscles tighten up, they can also start to take your posture and alter it. So let's say that these muscles tighten up and start to give you a posture similar to this. You're going to have the holes and the spaces that those nerves come out, they're going to get smaller. So at Ried Physical Therapy, we're a one-on-one, hands-on manual therapy-based clinic. So the first thing we do is we want to get rid of the irritation by using hands-on techniques to relax the muscles. We need to get rid of the swelling, so we have a couple machines that we use for that. Another thing that you want to do is get some blood flow to the muscles that are really tight. So we have, again, some more machines that, again, relax those muscles. And then what you want to do is once you get rid of the swelling and you've calmed things down, you want to use hands-on techniques to actually put everything back in place and make sure that those spaces are nice and tall in there so that the nerve can come out of. Now, once you've gotten things where you want it, you can also use tape to stabilize the spine where you want it. So we have some tape that works really well for that. We also have, if let's say the muscles are still tight and still pulling on different things and making things go out of place, you can use something called dry needling. It's most people don't even feel the needles go into the muscle, but you put a needle in there and it relaxes it by bringing it blood flow. Because if a muscle's tight, it squeezes all the blood out, and what we want is blood flow into that muscle and actually brings blood flow to the area and also helps heal the area so the body can help hopefully reabsorb as much of the material as possible. Now, once everything is where you want it, now you want to gently stabilize the muscles in that position so it'll keep it there, so that then the body can actually continue to heal and reabsorb that herniated disc. So the last bit of information, that it's a continuous process throughout the therapy treatment, is we want to make sure that people are thoroughly educated and know exactly what position they can get in if they start to have pain, how to drive, how to sleep, how to do certain things at work. And what you're doing is you're empowering the person to maintain the progress they've made instead of just having to come back and forth for pain meds and such not. So please call us if you have any questions, and thank you for your time.